Hi, thank you for joining me again on Dark and Twisted. I am Brandy, and today I would like to talk about a awkward thing to talk about, and I'm here to discuss female issues. Yes, I am going to go there because many females ask these questions over and over again. So I want to share with you my personal experiences and some situations I've been put through. So we're going to talk about being a female and having your period. A lot of women ask if I have more pain or if they have more pain during their period. And that answer is yes, yes. I have more, let's see, I actually don't cramp so much in my abdomen. All of my cramping goes straight to my lower back and to my right hip. This has been my story since I started my period at 12 years old. So for 2 weeks out of the month, my pain level goes from a 6 or a 7 to a steady 9 every month. And it is really hard to deal with. So another subject that is asked is about pregnancy with having spinal issues. I was always advised not to physically carry a child because of my back. Back in 2007, 2008, I actually had a pleasant surprise of being pregnant. Was I scared? Absolutely. But I looked at things that this might be my only chance to have a child, and I'm young enough that hopefully my body can bounce back to normal, or as normal as my body can be. So I'm going to talk a little bit more about that experience. When I found out I was pregnant, I was really scared because I was scared to have a child that has my back problems. So when you are pregnant at about between 15 and 20 weeks, they do offer a amniocentesis test, and that's where they take a bit of fluid that surrounds the fetus. Now, because I had been diagnosed with spina bifida, obviously this was a must. So what they do is they test the fetus for spina bifida and for Down syndrome. At that time, if results are positive, they do give you the option to abort. That is real life. That is a real life situation, plain and simple. So not only was I having anxiety about carrying the child and how my back would handle it, just thinking that my child could possibly have my spinal issues was enough to make my anxiety be over the top. So I had to move forward, which usually, and again, I'm going to go back, this was back in 2008, insurance does not cover these tests. I don't care what insurance you have. So I did have to pay out of pocket, and it definitely was not cheap. So at the time we did do the test, and it did come back negative, which obviously that relieved a lot of my stress, but I was also afraid because things can come out, down the road once that child starts growing up. Back when my mom had me, and that was 1981, these tests weren't offered. So you have to think how times have changed and how it's getting out there of how serious spina bifida is for any human being being diagnosed with it. And side note, spina bifida is a disability. It is a birth defect. Plain and simple, it can't be disputed. So moving forward, what was hard for me was when the child would start growing. See, because my spine is an S curve, my organs inside my body are squished. My lungs are being squished by my spinal cord. I do not breathe fully. I do have issues and have had these type of issues since I was in high school. Plain and simple, my organs are being squished. So doctors were afraid that the fetus wouldn't have enough room to grow. And so because of that whole situation, I was a high risk pregnancy from the start. I actually didn't really start showing until I was 5.5 months pregnant. That's really when my belly torpedoed out. I won't say popped out because it definitely was more like a torpedo. I will show you a picture of a back brace that was suggested I wear. I did wear this back brace. I did wear it at 5.5 months moving forward up to the birth of my child. Did it help me out? Yes, because the belt underneath kind of lifts up that belly and allows my lower spine to release some of that pressure. So 5.5 months, I was put on bed rest. I did have to remain active as in going on walks. I was having circulation issues. My feet ballooned up. I was retaining a lot of water. So moving forward onto the pregnancy. Obviously, I was still in talks with my spine doctor in Las Vegas throughout this pregnancy, where we were trying to figure out if giving natural birth pushing was going to be suitable for me. He advised me not to do it. C-section was advised because the doctor didn't want that extra pressure on my lower spine. He was thinking it could cause me more issues down the road. So I had to have a C-section, which I already have enough back scars. I was not thrilled to add another scar, especially into my abdomen. There is a lot of scary things that happen with C-sections. And so obviously that just brought my anxiety back up. So I did have a C-section. It was weird, definitely a weird experience. Actually, at first, my labor had to be induced because I had high blood pressure. Baby wasn't ready to come out. I was having some major issues. So once I started getting the contractions, good Lord. And again, the contractions were not in my abdomen area. They were all in my back. I was absolutely miserable. So of course I asked for an epidural. It took the nurse over an hour to find my spine because, again, my spine isn't straight. So if you look at my back, you don't see my spine. Like normal people with straight spines, you can see, the vertebrae sticking out. Not with me. There's nothing there. So over an hour, it took her to find my spinal cord. Finally, I was able to get the epidural, which obviously I was feeling pretty good after the medication kicked in. So I had a healthy baby girl. She has no issues like mom, like myself, which I'm very thankful for. But my daughter just turned 12, so we did hit the stage of possibilities with her. Now, if you've noticed any other videos on my little YouTube channel, I do have some gymnastics videos of her. She's really good, and I wanted my daughter to be able to do things that I wasn't able to do. Last year, my daughter was diagnosed with having a slight curve on her lower back, but nothing to be worried about, nothing compared to mine. But I was hearing her complain of lower back pain, her hips hurt, so that's where we had to move forward with the process of getting her properly diagnosed. But again, nothing as severe as mine. She has been in steady physical therapy, and she's doing really good right now. So here I am 12 years later. Do they think the pregnancy added extra stress on my spine? Maybe, but there was already a lot of stress in my spinal cord anyways. Would I have another child? No. That whole thing was so hard on my body. If I were to have another child, I would have to have somebody else carry the child for me. To the women out there that have more than one child and have similar spinal issues, wow. That's all I can say is wow. I don't know how you do it. My hat's off to you, that's for sure. So I hope you all, I hope this helps you. I hope I am validating your pain. I hope I'm validating your worries. And I hope I can just bring some information into your life. So toodles for now, and I hope you all have a great day. Thank you. Thank you all for watching my dark and twisted tales. If you like what you are hearing and you would like to know more, please subscribe to my channel. You can also follow me on Facebook and on Instagram. Toodles!